Hi, I'm Ingrid. I'm a Melburnian living with COVID, lockdown, curfew. This time it feels harder. The novelty's worn off. Can't go out to a cafe. Helicopters are above. This is weird. This isn't the Melbourne I know and love. I'm over this, just like I know many other Melburnians are. In my work as a mental health and suicide prevention advocate, and through my own mental health issues and my own suicidality, I know that when I'm talking to other people and we share each other's experiences, how helpful that is in itself. But we're actually having different conversations now. We're actually talking about what we haven't talked about before, which is how we're going today. How is our journey going today? We're working from home, we're communicating differently, and we're suddenly finding that we're in different places. We're working from home, we're working in the garden, we're working in much more relaxed environments, so some of that formality has gone. Some of us might look good above, but we're wearing tracky pants below and slippers below, which is actually nice and relaxing. It also means that we're more relaxed when we get onto a Zoom or get onto a device where we're talking to somebody. That's now given us an opportunity to build relationships in a different way. We're now having conversations where we're thinking about our words, our language, our actions. It all matters. We can now develop better, more enriched relationships with these conversations by asking how you're travelling today and saying, I'm not doing so well, this is hard. COVID is bringing about much needed change. It's normalising the fact that it's okay to be human, that it's okay not to be okay, and that by admitting it, by acknowledging it and validating it, that in itself can be really, really healing, as opposed to hiding it and pretending that all is okay and that we just keep pushing along. We're hearing constant messages about looking after our own health and well-being for the sake of ourselves, but also for the community. We are no good to ourselves if we're not well, and we can certainly make our community sick if we're sick. So now, for the first time in humanity, we've got an opportunity where we can actually work together and change the conversation, change the attitudes that have been conditioned into us to think about it's okay to be vulnerable. In my own recovery journey, it hasn't been a straight get well journey. It's been up and down. I noticed that there are times when I'm not feeling so great. So I learned to recognize my triggers and my boundaries. And in that, again, that requires honesty. Telling someone, look, I'm having a migraine, I don't feel so good, is okay. Now we're actually having conversations with each other around having a break. It's okay to go and have an hour's exercise or a walk or connect to someone. I know some of my colleagues were even saying sofa time's okay. Going into the garden is good for our mental health and well-being. If we haven't got a garden, go into another room. Talk to someone, have a cup of tea, take a breath. We now have a whole range of resources that are available online. If you visit headtohealth.org.gov.au, there will be a whole range of resources for you. This is from the mental health and suicide prevention sector. They've all come together to put websites, resources, information online. Lifeline, Sane Australia, Black Dog, Beyond Blue, they're all there. There's also updated information on coronavirus. www.headtohealth.org.au. Also, we've got now telehealth, a digital health service that is actually supported by Medicare. We can see doctors through telehealth or digital services. We only need a referral through our GPs to see a psychologist or a psychiatrist. As with any professional though, you don't have to go with the first one that you meet. It's around connectedness and having a click. If you click with that particular professional, that's great. But if you don't feel that you can be yourself with that health professional, try someone else. Your GP will generally have different referrals. Otherwise, go on to the Australian Psychological Society or the Royal Australian New Zealand College of Psychiatry for their resources of available mental health service providers. Thank you. Stay safe and well.